In this human diagram, we can see that the sphenoid bone sits right at the center of the cranium and that the tip of the wings is palpable from the lateral surface there just behind the eye. Similarly, in the horse cranium pictured here, we can see the sphenoid bone sitting just behind the temporomandibular joint. So the red and the maroon make up the temporomandibular joint. Just behind that, you can see a tip of violet bone that they have highlighted here. That would be the sphenoid bone for the horses. With half the cranium cut away here, we can see the sphenoid bone on the inside of the cranium, also resembling a bat-like structure, just as with humans, and that the tip of the wings is palpable there just along the lateral surface, which would be behind the eye of the horse. Okay, so the last bone for today in the face that I'm going to look at is the sphenoid bone. So the sphenoid bone, kind of shaped like a pair of wings, or like a bat wings is how it's often referred to. What I'm sensing is that there's a bit of a torsion this way for her, so that's why her left eye, all around the jaw and the eye and the temporal bone are kind of dropped down. You'll see that commonly if you've got a sphenoid torsion. So I've already palpated this when she came, as well as a couple weeks ago, and did notice that there was a lot of tenderness on the left side, and it's kind of tilted to the left. So I'm going to go in today and see what I can get released. I did get some releases last time, but again, I'm not sure if they've stuck or if I got enough. So for sphenoid bone, I'm coming underneath the head, and I'm using the TMJ as my guide. I'm going to start on TMJ and then slide a little bit anteriorly till I feel a divot. That divot would be where you can just barely palpate the tips of the wings of this bone. So I'm there, and now I'm just checking it. I'm going to try coming to the sphenoid from the opposite side, see if it feels the same to me. She's just twitched right, and she's holding pressure to the right. So I'm just providing that fulcrum, not pushing harder. I'm letting her determine this. But in my mind, I'm thinking about, wow, it's a big twitch. I'm thinking about laterally gliding the bone that way. Okay, so I'm going to gently come off that bone, so I feel like I've done enough for today. It's important not to overdo it, especially that bone can be really sensitive, and it's attached to many structures within the cranium there. So I'm going to take her for another integration walk and then finish up. If you look at this before and after, you can see that Jenna's left eye is a little bit sunken and receded back, has less wrinkles above the eye, so indicating a lot more tightness over that eye socket. And then looking at the nose, the nostrils are not so even in the first one. You've got the left nostril sort of pulled up and back, and then in the after you've got them coming down to a little more even. And lastly, you can see in the forehead area the uneven muscling. So the right forehead muscles are a little bit bigger than the left ones, but in the after photos, they are coming to a little bit more even. Some of the most common signs and symptoms seen with cranial torsions include metabolic issues such as unexplained weight loss or weight gain, changes to coat texture. Behaviorally, you'll see unwillingness to move forward or head tossing and teeth grinding, as well as chronic undiagnosed lameness.